Hello, welcome back to our podcast. Our podcast is about the healthcare professionals' mental health and well-being, brought to you by TWU undergraduate students. My name is Anais, and I am currently a pre-nursing major.
I'm Annabelle, and my major is pre-nursing.
I'm Allison, and my major is also pre-nursing.
I'm DeAndrea, and my major is psychology.
I'm Katie, and my major is psychology.
And today's topic is about different healthcare workers' mental health plummeting due to a multitude of reasons, and there's very little help for them to overcome these health problems that get created with very stressful and high emotional jobs.
First, we're going to go into our individual topics. So we have ICU nursing burnout. For that, my main points for this are that nurses are usually tired from long shifts and emotional trauma. Usually now nurses have 3 12-hour shifts, 3 days in a row, so that is quite long for them. And this causes them to make mistakes in treating their patients, and they might not always be fully engaged. I also provide a solution of implementing a mental health day for nurses so we can relax from these duties after having long days. There are resources given for nurses, but a lot of them require them to spend their own money or time. For example, go get their own therapist or just do things that they don't have time for, because an ICU is not a clinic. It takes a very long time. It's a fast-paced environment. And then hospital policies to prevent burnout are usually just right now, there's screenings or ideas that don't translate well to the fast-paced environment. And that's usually what there is for ICU nursing burnout.
For my topic, I had NICU nursing, and I wrote that NICU nursing can impact mental health because of the high stress and high emotion in the job that could be coming from whatever they experience with a patient or also their own personal things. And I also mentioned how the coping strategies that can help them as well. But a lot of the times, those coping strategies don't really work as well because they have to go out of their way, take their own time out of their day to go look for their help, and they can't really rely on others from the same work environment they work in, since they might not be the best help either. And overall, I also talked about hospitals not providing enough support, and that also training isn't enough to prepare nurses for the emotional toll in a hospital, since they do tell us what we can expect but never how to properly deal with certain emotions, which emotions can easily be involved in a lot of things. And that overall, hospitals should provide better health resources and give safe spaces and access to therapists, so that NICU nurses or nurses in general can take care of themselves while continuing to take care of their patients as well.
So I also wrote about NICU nursing, and my topics were very similar to the first two, but I wrote about how mistakes and errors can be made with fatigue, causing harm to the vulnerable babies, which can be happening due to nurses exceeding over the 3 12-hour shifts, which can cause burnout. And then hospitals have a shortage of nurses due to the pandemic, and then high turnover rates, which can also lead to a factor of being overworked. There's also stigma behind asking for help, and they're scared to lose their job or being perceived differently, just scared to reach out and get the help they need. So I provide ways to help nurses by getting rid of that stigma, having more support, and then better education opportunities, among other things.
For my topic, I wrote about the emotional toll that marriage and family therapists can take on, because they spend hours listening to people talk about trauma, relationship problems, and stress. Even though they're trained for it, that kind of emotional weight builds up over time, especially when they have sessions back to back. And that's where burnout starts to come in. When therapists have heavy caseloads, long hours, and little time to rest, all that stress is harder to manage. So overall, my topic is that even the people helping others with their mental health need support themselves.
My think piece was about the poor treatment people often experience in mental hospitals and laws around suicide and mental health treatment that are currently harming people, and how the mental health system typically mirrors the prison system.
Now we'll be going to the section where we'll be comparing and contrasting our topics in this discussion. So for mine, I found a similarity between NICU and ICU nurses that they both have long shift hours and more of that fast-paced environment, because to me the NICU is it's pretty much the ICU but with babies. So they're both experiencing that trauma because obviously, energy levels differ depending on the work hour of the job. So throughout the day, your energy levels are just getting more and more depleted. And as Allison mentioned, sometimes they're going over that time. And I'm sure ICU nurses do as well. And then there's a lot of trauma that is both in those jobs because you're watching patients die. And sometimes babies or people, they just don't always make it, so you're listening to that trauma. And you also might be working with low income communities, you might be working in areas, maybe there's a more violent community. It just depends, so you might see some things or hear some things, and all that's getting dumped on you throughout the day.
Yeah, and it's also like, as you mentioned, a very fast-paced environment where you have to go from one patient to the next, and then the next, and then the next, and barely have any time to think over what happened or take time to process. But NICU nurses also don't just deal with patients, but also with the patient's family and people around them that care for that patient. And the worry that parents or the family members may project can make a nurse feel pressured on not knowing how to respond to certain questions they may ask, or them not being sure of what may happen, since everything is it can come out of nowhere where things can just start going down or be better out of nowhere. It's a very it's like a roller coaster in a hospital. You never really know. And there was also in a recent study done by Celine Favrod and others in 2018 on mental health symptoms and work-related stressors in hospital midwives and NICU nurses that mentioned their mental health problems are linked to high quantitative, emotional, sensorial, and cognitive demands at work and high rhythm of work and demand for hiding emotions, which, as we pointed out, was basically it's mentioning the same things we talked about earlier.
So I found a similarity between all healthcare workers of the issue of shortages of them, which is not caused by a single factor, but rather just a combination of issues like high turnover rates, limited education, and impact of COVID-19, the pandemic that happened. And this can be shown in an article from the National Library of Medicine in 2023, and it says the nursing profession continues to face shortages due to the lack of potential educators, high turnover, and equitable workforce distribution. The causes related to this nursing shortage are numerous and issues of concern. So as you can see, there's just a worldwide concern, multiple issues happening, and they need to be fixed.
So I guess continuing off of that as well, I did mention before they do the toll listening to their patients' problems, and as they can come, you meet all sorts of people. Sometimes patients, they might not be the friendliest. You could be working on an inmate, for example, or someone who's been arrested. So sometimes people can get violent. This could be the patient themselves or the family if they're not getting the answers they want. And then I also did have some quotes pulled out. Let me go down to them. Where are my quotes? Okay. So I did also find that there is a comparison that it's usually common among younger nurses to get this burnout. So I did find it in According to What is Nurse Burnout? How to Prevent It by the American Nursing Association. I think it was published on April 2024 on the 25th. It says that results from a 2020 survey indicate that almost 2/3 of nurses, 62%, experience burnout, and it's especially common among the younger nurses, with nurses under 25 reporting that burnout. And then I know both of you guys from the NICU section did talk about a lot of errors being made. So that is also seen in examining the link between intensive care unit nurses burnout and perceived quality of life, which was a multi-center cross-sectional study, where it is stated that high burnout prevalence rates are linked to unsatisfactory nursing care quality, increased medication errors, infection rates, and falls that negatively impact patient outcomes.
All right. Different types of healthcare professions experience different kinds of stress. NICU nurses have to deal with patients and families And in NICU nursing, children are very different than adults. You have a lot less time when dealing with a crashing patient, for example. CPR is different with smaller airways, and you may not have a lot of time before our heart rate goes from 100 to 60 to 40 to 20 to just they're dead, you know. And this, like, younger patients can die from regular illnesses or have things like septic shock from things we wouldn't expect. And therapists have to take care of themselves to keep their emotions afloat while managing their patients' emotions and risk internalizing their patients' negative emotions. There's also stress from high physical danger in certain fields like emergency rooms where there aren't adequate protections for nurses against being physically assaulted by patients, and they are exposed to severe communicable diseases regularly on long shifts like MRSA, C. diff, potentially even rare things like anthrax, where you might have to quarantine off like a whole wing of the hospital, which is very stressful. And you might not be able to go home when you want to, which is, you know, like a big thing when you have a family. It is a lot of stress to simply not take physical danger, extreme pain or suffering, demands of management, and long shifts personally. A method they often tell healthcare workers to cope with when patients get under their skin is Q-tip, which stands for quit taking it personally. But with everything feeling stacked against you, it feels personal or like a wider systemic issue.
So one thing all of our think pieces had in common was stress in mental health, healthcare jobs. Annabelle talked about nurses having long 12-hour shifts and how they deal with trauma and sometimes seeing patients die. And Nai's focused on NICU nurses and how they have to worry about families, which add more pressure. And Katie compared that to therapists who deal with emotional stress by listening to their patients' problems and not taking that stress home. But the main difference is that nurses face more physical danger and fast-paced emergencies, and therapists deal with more emotional burnout. But in the end, all of our topics showed that helping others can also be very stressful for healthcare workers. And according to Rosenberg and Pace, they're researchers in the Journal of Marital and Family Therapy. They said that high workloads and limited organizational support increase emotional exhaustion in therapists. This shows that burnout is not just a personal issue, but it also comes from workplace conditions. And Quatera and his colleagues, the researchers in the International Journal of Environmental Research and Public Health, also found that therapists who practice self-compassion report lower burnout levels despite heavy workloads. And this proves that while stress is common, it can be reduced with support and healthy coping skills.
Overall, we do believe that hospitals should give resources to healthcare workers within the hospital, such as quiet spaces away from all the pressure and high demand of the job. Give them healthcare days, which they can take time from themselves from feeling overwhelmed with personal things or work-related issues, and also giving them trainings or have other professionals within therapy give them advice on what they can do, how they can go on about their mental health issues, how to deal with them, give them coping strategies that can help them throughout their journey as healthcare workers as well.
I think this definitely is needed for sure because I think especially that's why we're seeing the trend of younger nurses getting that more burnout, because they're just kind of thrown into it because nothing really prepares you for the job till you start the job.
Yeah.
So you can't really tell till you get there, but I think giving these people what they are going to be heading into would help them greatly. So
Yeah, it would honestly really help since everyone's very different. Everybody copes with things differently, and yes, in programs or as getting trainings in here and there, it can prepare you for what to do in certain procedures, but not prepare you for the emotional level, the burnout, the way you may feel after some point of working in the hospital field, which it's also best, like, how are we helping out others without helping or taking care of ourselves first?
Can't pour from an empty cup.
Yep, absolutely.
All right. On to our counter arguments.
Oh,
Are we on that part?
yeah. Okay. There are multiple different kinds of healthcare professions with multiple different types of stress, each unique and impactful in different ways. Effective coping skills are needed in a life that is filled with frequent stress. The stress of working in healthcare is emotional, physical, and often chronic. Healthcare workers experience higher rates of stress-related illnesses such as heart disease. These are related to chronic stress. There are multiple types of stress. There's temporary stress, use stress. Use stress motivates people to do things and is normal and natural, such as stress before a test. But chronic stress will start to affect your heart, your digestive system, your immune system, and their lives are filled with daily stress that gets chronic. When the body and mind experience stress for months or years on end, it feels as if it is constantly under threat and danger. The healthcare worker ends up as often as the patient and may be encouraged to ignore their health by the need to show up for intensive 12-hour plus 12 plus hour shifts. And these could be back to back, as previously mentioned, like 3 days of 12-hour shifts. And how are you gonna, take a day off to have a doctor's appointment? And hospitals could potentially help their employees by offering multiple mental health days per quarter, better parental leave, and comprehensive health care and mental health care that is free, along with pensions. Because another issue is older nurses potentially staying on contracts longer or misleading contracts that may keep people from retiring or worrying about retiring. And additionally, we didn't mention it, but I think it'd be a great help would be free dining plans, because I don't know if you've ever been to a hospital cafeteria, but nurses have to pay for each of their meals at the hospital cafeteria.
And maybe even more nutritious meals, because
Yes.
I think a lot of the stuff added is fast food, because there is always like people, they talk about the nursing diet, and like I'm like, they shouldn't have the diet of a trucker. Like it's just like I've seen that, because like they're like, oh, like why are these diets of nurses adding up, and why are like things like certain stats of their health not being as well and being negatively impacted. I'm like, you're only giving them certain things like McDonald's, and they don't have time to leave the hospital and go get a salad.
Yeah.
That's not what they have time for. So they need that resource like right downstairs. They don't need it 2 blocks away from where they work.
Yeah.
Yes, definitely. It's like within every single job or any job field, they should always, if specifically like hospitals, which they are constantly helping out others, they should also be taken care of and watched out for, since they are taking their time and putting themselves out there just to take care of others, to make them feel better in such other ways.
Exactly. Yes, this is our presentation, and we hope you enjoyed it. And was there anything else we wanted to add?
Tune in next week.
Tune in next week. I don't know if I can do this every week.